Bone augmentation is a common procedure in implant dentistry that aims to enhance bone density in the jaw to ensure the success of dental implant placement. In this video, we will discuss the importance of bone augmentation in implant dentistry and how it can improve the outcomes of dental implant procedures. What is bone augmentation? Bone augmentation, also known as bone grafting, is a procedure that involves adding bone or a bone substitute to areas of the jawbone where bone density is lacking. This can be necessary for a variety of reasons, such as tooth loss, periodontal disease, trauma, or congenital defects. Without sufficient bone density, dental implants may not be able to integrate properly into the jawbone, leading to implant failure. There are several different types of bone augmentation procedures, including autogenous bone grafting. This involves taking bone from another part of the patient's body, such as the hip or chin, and placing it in the jawbone. Allografts. These are bone grafts taken from a donor and processed to remove any potentially harmful material before being placed in the jawbone. Xenografts. These are bone grafts taken from animals, usually cows, and processed to remove any potentially harmful material before being placed in the jawbone. Synthetic bone grafts. These are bone grafts made from synthetic materials, such as calcium phosphate, that mimic the properties of natural bone. Why is bone augmentation important in implant dentistry? Bone augmentation is important in implant dentistry because it provides a solid foundation for dental implants to be placed. Without sufficient bone density, dental implants may not be able to osseointegrate properly, leading to implant failure. By enhancing bone density through bone augmentation, dentists can improve the success rate of dental implant procedures and ensure long-term stability and functionality of the implants. Bone augmentation is especially important in cases where patients have experienced significant bone loss due to tooth loss, periodontal disease, trauma, or congenital defects. In these cases, bone augmentation may be necessary to build up the bone structure before dental implants can be placed. Without bone augmentation, the implants may not have enough support to withstand the forces of chewing and speaking, leading to implant failure. Bone augmentation can also help improve the aesthetic outcomes of dental implant procedures. When bone density is lacking, the jawbone may appear sunken or hollow, leading to an aged or unhealthy appearance. By enhancing bone density through bone augmentation, dentists can create a more natural-looking and youthful appearance for patients who have lost teeth or experienced significant bone loss. How is bone augmentation performed? Bone augmentation is typically performed as a minor surgical procedure in a dental office or outpatient clinic. The procedure may be performed under local anesthesia, sedation, or general anesthesia, depending on the patient's needs and the extent of the bone augmentation required. During the procedure, the dentist will make an incision in the gum tissue to expose the underlying bone. The bone graft material will then be placed in the area of bone deficiency and secured in place with screws, pins, or sutures. The incision will be closed with stitches, and the patient will be given post-operative instructions for care and recovery. After bone augmentation, the patient will need to allow time for the bone graft to heal and integrate with the surrounding bone tissue. This process, known as osseointegration, typically takes several months to complete. Once the bone graft has fully integrated, the dentist can proceed with placing dental implants in the augmented bone. Benefits of bone augmentation in implant dentistry. There are several benefits of bone augmentation in implant dentistry, including improved success rate of dental implant procedures. By enhancing bone density through bone augmentation, dentists can improve the success rate of dental implant procedures and reduce the risk of implant failure. Long-term stability and functionality of dental implants. Bone augmentation provides a solid foundation for dental implants, ensuring long-term stability and functionality of the implants. Enhanced aesthetic outcomes. Bone augmentation can improve the aesthetic outcomes of dental implant procedures, creating a more natural-looking and youthful appearance for patients. Preservation of jawbone structure. Bone augmentation helps preserve the jawbone structure and prevent further bone loss, maintaining oral health and function. Bone augmentation plays a crucial role in implant dentistry by enhancing bone density in the jaw to ensure the success of dental implant procedures. By improving the foundation for dental implants, dentists can increase the success rate of dental implant procedures and provide long-term stability and functionality for patients. If you are considering dental implants and have insufficient bone density in your jaw, talk to your dentist about the possibility of bone augmentation to enhance the outcomes of your dental implant procedure.